Dr. Magdalene Kirschner from Victory Wellness and MedSpan. Welcome to our Facebook Live tonight. We have a very special program for you. We're going to talk about fire after 40. And we have our wonderful guests here, Michelle and John, and they're going to share some information with us, some of their experiences with fire after 40, and they're going to talk about their bioidentical hormone replacement and some lifestyle changes that they have made to make sure that that fire keeps on burning bright. Isn't that correct?
That's right.
Yep.
Absolutely. So just a little bit of background. As we know, after 40, sometimes our romantic lives are not what we would hope they were. And we don't know that sometimes these reasons are physical. They're not necessarily emotional, but they can be depression, anxiety, being on certain medications certainly affects our sex life just as well. But very often improper hormone balancing and loss of hormones for women, menopause, whether it's due to aging, the average age of menopause for women is 52, or surgical menopause that women have. It's from hysterectomy, like what happened to Michelle. Also, chemotherapy, radiation can throw women into menopause, as well as stress, such as COVID, a pandemic, can actually throw a woman into menopause acutely. And if that happens, we lose our estrogen, we lose our testosterone, we lose our progesterone. And then we start that affects our sex life very negatively. It affects our moods. We become depressed, anxious. We can't sleep. We have vaginal dryness. We have loss of sensitivity. And we just kind of turn away from romantic relationships. For men, it's called andropause. And after 35, we have loss of testosterone progressively. And when men start feeling, probably after about 45, most men start coming in and they notice that they feel more fatigued. Their libido is less, and maybe even some signs of erectile dysfunction. 50% of men at the age of 50 experience some forms of erectile dysfunction, and they have a lot of anxiety about that and depression and often shame. They don't want to go and ask their doctors. So, and what we want to talk about today, that there's no need to live like this anymore. There's many answers. There's a lot of help to address these problems for men and for women, and make sure that our fire burns very bright till a very long age. So introducing our couple today, maybe we can start with Michelle. Hi, Michelle.
Hello, everybody.
So maybe you can share with the viewers a little bit, how was it before the hormone replacement and balancing? What made you interested in it? How did you come to get hormone replacement? And how do you feel now?
Excellent, and thank you so much for asking, and thank you for putting on this type of program for everyone. My story is that I actually had a hysterectomy when I was about 35, so definitely had the decrease in the hormones at about that point, and noticed a lot of issues with sleep issues, irritability. I mean, I was actually doing things and saying things that my brain told me to stop, but I couldn't stop. And I felt bad about it, but I just couldn't control myself. And I was doing some pretty mean, I felt like I was being mean. Skin issues. I was breaking out. I was gaining weight, had really low energy. And when I went to my primary care doctor, I was put on Effexor. And
what is Effexor?
So it's an antidepressant.
Right.
And so I was put on the antidepressant, and that really didn't affect the night sweats as much as I would have liked. And unfortunately, I felt calmer, but I also felt dumber. It really dumbed down everything. My forgetfulness was unbelievable. And when I went back to my primary care physician, the answer was to double the dose. And about that point in time, I was looking to see if there was possibly another answer out there, because doubling the dose and getting more forgetful and more just dumb it really started to get frustrating. I couldn't remember anything. And so I do medical education conferences, and Dr. K actually spoke at one of them.
Yeah, to stop you for a minute, I want to talk a little bit about the effects of antidepressants. So what typically happens with women out there, because I see this scenario over and over, especially if they have hysterectomy, for example, what happens to women, they'll go into acute, it's called menopause, especially if their ovaries are removed, and even in a woman who's 20 years old, she'll experience menopause at the age of 20 if she has total abdominal hysterectomy. Very often, these women are not told about the post-hysterectomy effects, meaning going into acute menopause, losing your sex drive, having painful intercourse, depression, fatigue, anxiety, irritability, all these things that we experience as menopausal women. So when women go to their doctors, or typically they bring these complaints to them, not knowing what's going on, and very often they get put on antidepressants as treatment for menopause, which is truly uncalled for and very harmful to many women, because antidepressants are considered dementogen. Dr. Dale Bredesen at UCLA has done a lot of research about that. They increase risk of Alzheimer and dementia significantly. So if you keep a woman for years and years on Lexapro or Effexor or any of these other antidepressants, their brains are affected very negatively. Their menopausal symptoms do not improve. Like Michelle said, well, I got more sleepy and dumber, and that's about it. And I still had hot flashes, and I still experience lower sex drive and vaginal dryness and painful intercourse. It does not solve any of these issues being put on antidepressants. So I think that any woman who has had hysterectomy for whatever reason, and also women who are menopause or premenopausal, we see women here, they should seek out some other options for themselves, and natural hormone replacement is the most viable option and most life-enhancing option for women, as I see it today.
Absolutely. Well, the interesting thing was we did the medical conference, and Dr. Kirshner was presenting on menopause and andropause.
About our book.
Yes.
Remember the conference in Nashville? Last December in Nashville, we were talking about natural hormone replacement, get your mojo back, right? And I was the presenter, and that's how we learned about hormones. Go ahead.
Absolutely. Well, the funny thing was that Dr. Kirshner was sitting there talking, she was presenting to a group of physicians and talking about lowered sex drive and, and sleep and skin issues and, vaginal dryness and less satisfaction with, just in relationships in general. And she was going through this lecture, and I was literally sitting in the room, and I'm supposed to be running what's happening in the conference, and I am writing down going, that's me, that's me, that's me. And so we followed up with her afterwards. I mean, it was uncanny that every single symptom she was going through was exactly what I was going through. And to the extent that it was starting to even bleed over into our lives and in our relationship, and how we were, and my energy to even have a relationship. And, it was really uncanny. And then we met with Dr. K right after that meeting. Yeah. So it was outstanding. And we started so she did a full workup on me, and so full lab work, discussed what was going on, and really kind of started out doing the bioidentical hormones and the hormone replacement therapy. And it was like a light went on. Just absolutely did not need to take the Effexor anymore.
Michelle, how long did it take you to wean yourself off of Effexor?
It took me about 2.5 weeks, which isn't very long.
Effexor, by the way, Lexapro, Effexor, some of the antidepressants, they cannot be stopped suddenly because you actually will go into withdrawal. So it's important to wean them off. It's best to go with the help of your doctor.
And even with the help of the doctor and going as fast as I was, it was rough. It was rough getting off.
What were some of the symptoms that you were having as a withdrawal from Effexor, from antidepressants?
I actually was more tired, more fatigued. I felt sick, physically ill, nauseated, and a huge surge of anxiety. Mm-hmm. It was really rough. It kind of just getting.
You can also have crying spells, depression. Many people have a little bit of a rough going from high doses of something like Lexapro. I've seen Paxil, Effexor when they're getting off. So it takes a little bit of patience to accomplish that. And
the night sweats, even though it really never did much to the night sweats, I think some of the night sweats were associated with mental just being overwhelmed and not being able to think through things. So it was affecting me and making me even more anxious. And so during that time, it was just, it was socially becoming an issue because I was just breaking out to these crazy sweats at times.
Which are called, night sweats and
Yeah.
hot flashes, typically, these are called that women. So I see this a lot with professional women. That's something that brings them in because they say, I'm in a board meeting, I'm wearing my suit, and I start sweating and my hair is getting wet. And it's so embarrassing.
Oh, it's terrible.
And I don't know if
Yeah.
I can work like that at the level that I'm working. So I see quite a bit of that as a complaint from women.
Absolutely. And that is some of the things that I noticed right away that just reduced immediately with the hormones was I felt feeling less snappy at people, less just jumpy. I was able to.
How about John?
Yeah, right?
Usually it's the husband that
Yeah.
takes the brunt of our snappiness.
There were times that I went, he's going to leave me. I mean, it's like which again wasn't real, but at how I was feeling before that, where it just everything's becoming overwhelming. I was feeling like he was going to leave me because I was always sweaty and I didn't have the energy to didn't have the energy to do my hair, and it didn't matter if I did my makeup because I was going to wipe it all off because I was sweating. And I'm tired and irritable and falling asleep on the couch. We were just talking about that, where our usual evening would be, talk about no romance. You just kind of come home and you're tired at the end of the day and you eat some dinner and then we sit on the couch and fall asleep, and that's just, it's like we're 80 and we're not 80, and so that changed. That was
without hormones, you kind of are.
Yeah, exactly.
Well, they were removed 35 years ago. Exactly.
And then one of the biggest things that I noticed is that, that it was, just the sexual satisfaction and how that really that changed quite a bit. It was always satisfying, it was always good, but it's so much better. It feels like a light turned on. I feel like I'm not pushing through the day anymore, which is exactly how you described it when we were in Nashville. You said women feel like they're pushing through the day, and that's how I felt, like I was just pushing through the day, and all of a sudden I enjoy the day now. I want to get up and do my hair and makeup and get dressed up, and skin looks better and I feel better. I'm more awake, I sleep better, and just really enjoy being around each other a lot.
And look, she curled her hair. That's a sign of high estrogen, by the way.
Yeah.
When a woman after 50 curls her hair.
Exactly.
And she wears her makeup, that's a very good sign. That means her estrogen level is adequate.
Exactly.
Because that's definitely something in us women that as we start losing our estrogen, suddenly we no longer feel this, we want to be sexy, we want to be feminine. That kind of starts going away. Well, when our estrogen is our premenopausal level, we do feel like curling our hair and being feminine and putting on mini skirts and all that other stuff that we do. But hormones in general, estrogen, testosterone is very responsible for libido in women as well as men, but us women have 1/10 of testosterone that men do, and that is responsible for our libido, how much sex we desire. So it is an important adjunct for many women in hormone replacement, and many women love it. If you want to stop their hormones, one thing they tell you, what they won't stop is their testosterone. They want to keep that going. It gives you energy, gives you confidence, responsible for libido. Estrogen is responsible for, it's an antidepressant for us. It elevates serotonin in our brain, so there's no need for Effexor if you have adequate estrogen levels. It also is a very important in vaginal lubrication, which we can actually have non-painful sex, which is kind of nice to be able to do that. It's also responsible for increased sensitivity and clitoral sensitivity. Therefore, we can have orgasms. We can actually have multiple orgasms. We can actually experience all sorts of amazing things. And like I always say, that's amazing. After 50, I'm loving this part of my life because I have the wisdom and experience. And my body functions like I'm 20 years old. And that is a beautiful place actually to be. So we're going to go to John a little bit now. John is sitting patient over there. You go, oh God, now she's going to grill me. So tell us, John, a little bit your story. Like, how was it before? What was your experience? How you learned about hormones? And how do you feel now? How is it benefiting your life right now?
Well, we met, obviously, at that medical meeting, and you was at the talk and got curious and then followed up with you. And for me, it's just aging. I want to have the energy.
And how old are you, John? Would you tell the audience how old?
I'm 54.
54.
Yeah.
Okay.
Yeah. So I wanted, at 54, I got a lot of friends that are, they're retired and we're golfers, and they go, we're going home to take a nap after we play golf, and I'm like, who's napping now? I mean, I'm taking the hormones, and it's got me back. I got all the energy in the world back to when I was like 20 and 30, and that's for me what I wanted. I'm able to get up and go to the gym and work out as intensely as I was several years ago versus just showing up at the gym
and show them off your muscle.
Oh yeah.
So typically in men, what we see as they go into andropause, which is starting to lose testosterone after 35, but it gets a lot worse after 50. Loss of exercise tolerance is one thing that men complain about. Men that are used to working out say, well, I press weight for 2 hours and I don't see that much muscle being built. That's because we lose testosterone. Men lose testosterone. It's responsible for our muscle buildup. So if we replace testosterone in men, they have improved exercise tolerance. They don't get tired from working out like John did. They don't have to take naps after their golf game. They can go and enjoy themselves and have a romantic evening with their girlfriend or wife. And also men will notice redistribution of fat and increased muscle mass, as John showed us. He's got some good muscles going. And also men will notice that the belly fat disappears, that most men after 45 start to experience, which is called visceral fat in medical jargon, and it's responsible for a lot of the heart attacks and strokes that men experience. Still number one, in spite of COVID, number one cause of death is cardiovascular disease in the United States. And again, so there's something we can do to help ourselves to redistribute our fat, lose weight. Testosterone improves metabolism, speeds it up. Therefore, we experience weight loss even if we don't do anything on testosterone. In about 6 months, you notice your weight going down. So, another thing that men complain about, like John, is fatigue. Sometimes the wives bring the men because he naps all the time. That's a complaint I hear after 50. A wife will bring him in because it's all he does is nap. We don't have a relationship because he's asleep.
Right.
And they'll bring them in to do something, to do testosterone or hormone replacement or get help for the men. And another, I think we've touched a little bit when I opened up, the erectile dysfunction that most men do experience. 50% at the age of 50, 60% at the age of 60, 70% at the age of 70. Men experience various forms of either soft erections or not being able to maintain erections. There are various, they just basically don't function like they were 18, and that's very bothersome to a lot of guys, and they don't want to talk about it, and they feel ashamed to go to their doctors. And so we're here to talk to you to say there's nothing to be ashamed of because you can fix all these problems. That's with hormone replacement, but also, John, you tried?
Cialis.
Cialis.
Yeah.
So we have for erectile dysfunction for gentlemen that feel they need it. We have Cialis. We have Viagra, which improve erections. Cialis is referred to as a weekend drug because it lasts from 48 to 72 hours. You can go on a weekend and have fabulous time. I'm sure you guys did, right?
Yes,
So
absolutely.
tell us about how has your sex life improved before and after the hormones?
So the biggest thing is first of all, my enjoyment with it, but then secondarily how I'm actually have the energy to plan to have, to actually go do something special and to actually have some fun. One of the things we did, COVID stuff is cleaning out, all your cabinets and drawers. And I found this entire drawer of lingerie that I had bought years ago that was just sitting there. It had not been, I'd forgotten I even had it. So we started pulling out, and so, basically pick pick your outfit.
Leave.
And yeah, and it's been kind of fun. Whereas before it was like you fall asleep on the couch and it's not very sexy. It's
Now, before what you would have done, you was
Yeah.
like, oh God, I hope he doesn't see this, so I don't have to put it on.
I don't have to put it on.
That would have
Exactly.
been, I know exactly what it would be.
Totally.
To do that, right?
And now it's like which one,
Like, oh, yeah,
but
let's,
hey,
which
let's
one do I
kind
put
of
it on
fun.
to model that for him? Exactly. So, and John, how would you say for you, your romance in your life has improved?
I think just overall energy and just the increase in sex drive. It's more like when I was in my 20s and 30s.
So you guys meet like twice a day, like in your teenage years?
Yeah, actually.
Two-
Backseat of the car and all
2-3
that. Like you
times
can't
a
wait
day.
to get there.
Yeah. Exactly.
Yeah, exactly.
Yeah,
Well, I do. I walk around telling him he's cute all the time. So yeah.
She does. She does. That's why I asked her to do this testimonials. They came to my office. She kept on saying, "Oh, he's so cute. Oh, he's so cute." Like, oh God, it's all working.
it definitely works. Yeah.
Okay, so anything for the audience here? Any tips, any suggestions that you guys might have before we close?
I think the only thing is that John and I, when we were first discussing it, part of the concern he had was about the PSAs and the lab work, and I think that's one of the pieces that we were so impressed with was the in-depth discussion that we had about that with you and the lab work that you go through with him. And it's actually resulted in him not having to take the statins, which he really doesn't tolerate well, because you're addressing his thyroid instead. So, yeah.
Yeah, so for example, what I typically do, we do a little bit of a preventive medicine for our clients here too. So we do full labs, we check all the hormones, including thyroid. For gentlemen, we check the PSA to monitor PSA, liver, kidney function, vitamin D levels, which is important with COVID now, with immunity as we're learning. So when John came in, he had these questions because he got on Google and he knew all his stuff. So he knew that there's word out there testosterone could cause maybe prostate cancer, testosterone this, testosterone that. And just like you see about COVID, there's so much controversy and misinformation that it's very hard to kind of sift through this and to know the truth. So the truth about prostate cancer and testosterone is that at this point, the testosterone does not cause prostate cancer. Testosterone can help the prostate cancer grow faster if you already have one. That's the final word on testosterone and prostate cancer right now. So, but we do check PSA level, make sure that it's normal. If it's elevated, we will send you to a urologist to address that issue. But if it's normal, we'll go ahead with treatment. And then I follow this at first 6 months, then once a year, we just make sure that you're okay. Testosterone also can elevate a red blood cell count, especially if the dose of testosterone is high. So we monitor that for you. If it becomes too high, we will send you to maybe donate blood. So these are just some of the risk of heart attack and strokes with bioidentical testosterone that's not given orally is virtually nil. There have been some problems with oral testosterone because as it went through the liver, it caused blood clots. It was associated with blood clots. Nobody really uses this anymore. I've seen it once or twice from other physicians, people being treated like this, but which is not appropriate. But pellet form or injectables, testosterone is safe. And we're addressing, he also had a little bit of a low thyroid, which we're addressing that issue in him to help him be, low thyroid can result in elevated triglycerides and cholesterol. So we're trying to address those issues. We're trying to address the root causes of his problem, not just put a Band-Aid on it. So, and we're monitoring his cholesterol. The same with women we do exactly the same labs, and we try to identify prediabetes, for example, kidney problems, liver problems before they get out of hand for women. That with bioidentical hormones, when they're balanced properly, estrogen with progesterone, the many scientific literature out there, many of it done in Europe on bioidentical hormones, shows that there's no increased risk of breast cancer. If anything, it might be even lower if balanced properly, estrogen with progesterone. So, we watch those numbers very closely. We know the appropriate ratio that a woman should have of these hormones. And since I've been in practice in 6 years, we have not seen we've seen maybe one case of breast cancer in somebody who was significantly overweight, which in itself is a big risk of breast cancer. Overweight, drinking alcohol, statins, actually, all those things. Also, use of birth control pills, all that results in increased risk of breast cancer, not just hormones. So we have to watch our lifestyle overall to lower our risk of all these things. And any questions? Does anybody over there has any questions? Do you see anything, Tracy?
Mm-mm.
No? Okay, so one thing I want to mention here, we want to invite you for a blue peel. We were having this lemon kind of celebration of lemons this summer, because lemons, they're yellow, they're happy, they're fruity, they're citric, right? And it's kind of a fruit of the summer, lemonade. I always like to see lemonade with lemons,
Yeah.
freshness, right? It's like something happy about lemons. So we're looking at some peels for facials. There's what's called a blue peel that's very popular, and it's, you know, lemons have citric acid. Any of the acids, whether it's lactic acid, salicylic acid, citric acid, they are exfoliators. All acids are exfoliators and anti-inflammatories. So we have blue peel that is an acidic peel for the face, and it's called a lunch peel because you can get done quickly and you can walk right outside glowing, which is an amazing thing. So we have a special, we offer 20% off on our blue peel right now. And also we have another popular peel, which is glycolic acid peels with a medical grade here, which are 50 to 70% glycolic acid, much more than which you can get from your esthetician. You can get it from me. So we also invite you to have those done right now. We're going to have a special 20% off if you care to get that. And any of you guys want to add anything, or?
Nothing other than it's been absolutely fabulous working with you. I feel like it's collaborative with you, and it's, I mean, for anyone who's having any of those symptoms, not only are you not alone, but
There's help.
please talk to Dr. Kirshner about it. And it's not just you don't need to deal with feeling like that.
Right.
Yeah.
Exactly. And also, you know, the hormones, proper hormones, it helps to cope with stress. I've had many women, because I remained in the essential business during COVID, I was open because I said, well, we'll not have women jumping off of bridges going into acute menopause during
Right.
COVID. Many women have told me that if it wasn't for the fact they were on hormones, they wouldn't have been able to cope through this pandemic when it first started. So it was just so helpful for them just to be able to cope and make plans and keep the family together. So it's very important. Okay,
Absolutely.
thank you.
Thank you.
Telephone number.
Oh, wait a minute. Call us at if you come for a free consultation for talk about hormones or what your options are. Phone number is 513-936-3065, or you can find us on online, victorywellness.com.